You eat healthy. You exercise. You avoid junk food. So why can your cholesterol still be high? And here's where things get interesting. Health educator Barbara O'Neill has argued that cholesterol itself isn't simply a bad substance, and that the liver naturally produces cholesterol because your body needs it. And she's right about one important thing: cholesterol is essential. But does that mean high LDL cholesterol isn't dangerous? That's where the science gets more complicated. Your body actually needs cholesterol. Cholesterol isn't a poison. Your body uses it to build cell membranes and make important hormones and other substances. Your liver also produces cholesterol naturally. So the goal isn't to have zero cholesterol. The real question is, how much of certain cholesterol-carrying particles are circulating in your blood, and what is your overall cardiovascular risk? Current 2026 American Heart Association and American College of Cardiology guidelines continue to recognize LDL cholesterol and other atherogenic lipoproteins as important contributors to cardiovascular risk. So why can your cholesterol be high even if you eat healthy? So let's start the video. Don't forget to subscribe our channel. Number 1. Genetics. Some people inherit genes that make it harder for their bodies to remove LDL from the bloodstream. One example is familial hypercholesterolemia, which can cause very high LDL cholesterol even in people who eat well and exercise. So high cholesterol isn't always a reflection of your diet. Number 2. Your healthy diet may still be high in saturated fat. You might be eating foods you consider healthy but consuming quite a lot of saturated fat. Butter, ghee, fatty meats, full-fat dairy, coconut and palm oils can contribute significant saturated fat. The American Heart Association's current dietary guidance emphasizes replacing saturated fats with unsaturated fats rather than simply eliminating all dietary fat. So healthy doesn't mean unlimited. Number 3. You may not be eating enough soluble fiber. This is another overlooked factor. Foods rich in soluble fiber, such as oats, barley, beans, lentils, apples and other plant foods, can help improve LDL cholesterol levels. A heart-healthy dietary pattern is generally rich in fiber and emphasizes minimally processed foods, fruits, vegetables and whole grains. But what about Barbara O'Neill's claim about cholesterol? Barbara O'Neill has questioned the idea that cholesterol itself is the main cause of heart disease. She has also emphasized that the body needs cholesterol and has discussed the liver's role in producing it. The first part is true, your body absolutely needs cholesterol. But that doesn't mean elevated LDL is harmless. Modern cardiovascular guidelines and a large body of evidence distinguish between cholesterol being biologically necessary and having elevated levels of atherogenic lipoproteins in the bloodstream. In other words, cholesterol isn't the enemy, but chronically elevated LDL can still increase cardiovascular risk. Number 4. You don't have to be overweight. Here's another surprising fact: a thin person can have high cholesterol too. Your body weight doesn't tell you what your LDL, triglycerides, HDL, or other cardiovascular risk markers look like. That's why cholesterol needs to be measured rather than guessed from appearance. Number 5. Age, hormones and health conditions. Cholesterol levels can also change with age and hormonal changes. Certain conditions, including hypothyroidism, diabetes and kidney disease, can also affect lipid levels. And some medications can influence cholesterol. So if your cholesterol suddenly changes, it's worth discussing possible causes with a healthcare professional. Your diet matters, but so do your genes, saturated fat intake, fiber intake, physical activity, age, hormones, medical conditions and medications. And one more thing. Don't fall into the trap of thinking cholesterol is good or cholesterol is bad. The reality is more nuanced. Your body needs cholesterol. But elevated LDL and other atherogenic lipoproteins can increase cardiovascular risk, which is why your complete lipid profile and overall risk matter. So if your cholesterol is high despite eating well, don't panic and don't blame yourself. Find out why it's elevated and discuss the right approach with your healthcare professional. Because sometimes, the healthiest thing you can do isn't to follow another internet health claim, it's to understand what your blood test is actually telling you.